So let us discuss our first question. What is the recommended technique for achieving local anesthesia in the maxillary lateral primary incisor in a young children? So the question here asks the recommended technique of local anesthesia in young children. So remember, the best option here would be infiltration. So this is the infiltration anesthesia in the maxillary lateral incisor region. It is recommended technique for achieving local anesthesia in the maxillary lateral primary incisors in case with the young children. So the recommended technique is the infiltration anesthesia. So in the infiltration, that involves the injection of the anesthetic solution directly into the soft tissue surrounding the tooth. So targeting the nerve endings in the area. So this technique, it is commonly used for providing local anesthesia in specific tooth region, including the maxillary lateral primary incisors. So for specific tooth, we can give infiltration anesthesia in the answer of choice here would be D. Moving to the next question. Which statement is true regarding the use of intraligamentary anesthesia in the upper jaw? The answer here is C. The intraligamentary anesthesia is often used as a supplement technique in the upper jaw. So intraligamentary anesthesia, it can provide effective anesthesia for the specific tooth that is being treated. So the intraligamentary anesthesia, it is frequently used as supplementary technique in the upper jaw. So the infiltration technique, they are the commonly used to provide reliable pain-free anesthesia. Intraligamentary anesthesia may be used in addition to enhance the anesthesia for specific tooth when the infiltration alone may not be sufficient. So answer here is C. Option A, reliable pain-free anesthesia is possible using intraligamentary anesthesia. This statement is not entirely true. As the intraligamentary anesthesia, it can provide effective anesthesia for specific teeth being treated, and it may also not always guarantee pain-free anesthesia for all cases in the upper jaw. So that's wrong. Second option, it is primarily used for providing anesthesia to periodontal ligament. It's the infiltration technique, it's the most important we use, and it is primarily used to providing anesthesia to periodontal ligament and bone surrounding the specific teeth. So the injection is made into the PDL space. Option D, it eliminates the adjacent tooth anesthesia in the upper jaw. So it aims to provide anesthesia to a specific tooth. So it does not necessarily eliminate anesthesia in the adjacent teeth. Adjacent teeth, they may still require their own anesthesia if needed for the dental procedure. So answer here is C. During nasopalatine nerve block, the nerve, it is inserted into which area? Well, during a nasopalatine nerve block, the needle, it is inserted into the incisive foramen. It is inserted near the incisive foramen. So the nasopalatine nerve block, it is performed by injecting the anesthetic solution near the incisive foramen to anesthetize which nerve? It's the nasopalatine nerve that provides sensation to anterior anterior part of the hard palate. The greater palatine canal, it is associated with a different nerve block technique and not the greater palatine nerve block, it provides anesthesia to posterior part of the hard palate. Infraorbital canal, it is associated with it is not the relevant answer. And pterygomandibular space, it is associated with the inferior alveolar nerve block. So your answer is incisive foramen. Moving to next question. After a long nerve block, the patient complains of temporary difficulty in chewing and controlling food in the mouth. What could be the nerve that could be affected? Well, the answer here is a trigeminal nerve. The trigeminal nerve, it is responsible for the sensory innervation to face and motor innervation to muscle of mastication that are involved here in chewing. So anesthesia to the branches of trigeminal nerve such as the long buccal nerve can temporarily lead to difficulty in chewing and controlling food in the mouth. Hypoglossal nerve, it is a nerve that is responsible for movement of the tongue. So anesthesia of the hypoglossal nerve, it results in tongue weakness or difficulty in articulating certain sounds, but it won't directly cause difficulty in chewing or controlling food in the mouth. So option B, facial nerve. Anesthesia of facial nerve might result in temporary facial muscle weakness or palsies, but it does not affect chewing or controlling food in the mouth. The glossopharyngeal nerve, it is primarily responsible for swallowing and throat muscles. So anesthesia of glossopharyngeal nerve might affect swallowing, but it is less likely to cause difficulty in chewing or controlling food in the mouth. So that is why your answer is trigeminal nerve. During an infraorbital nerve block, the patient experiences severe pain and swelling in the area of injection. So that could be due to the answer is accidental injection into blood vessels. So if during infraorbital nerve, so while you are giving an infraorbital nerve, what happens is the needle accidentally punctures a blood vessel, and anesthetic solution, it is injected into the bloodstream. So that could lead to severe pain and swelling. So the anesthetic solution, it can irritate the blood vessels and surrounding tissue, causing this reaction. The infection at the injected site. Infection at the injected site, option B, it can indeed cause pain and swelling, but it does not typically develop over time, and it is not an immediate risk to the swelling itself. Option C, allergic reaction to anesthetic solution. Allergic reaction to local anesthesia, they are rare but possible. So they are associated with itching or rash or systemic symptoms. The patient experiences systemic symptoms like breathing, drop in BP. So they are not typically allergic reaction symptoms. So answer here is A. Anesthetic toxicity, it can cause systemic symptoms like dizziness, confusion, tremors, seizures. So that are not mentioned. So answer is obviously A. Following an infraorbital nerve, the patient reports numbness in the upper lip and gingiva, but still experience pain on the maxillary central incisors. So answer here is option D. So the middle superior alveolar nerve innervates the maxillary central incisors, If the needle accidentally inject if the needle accidentally inject the anesthetic solution into the middle superior alveolar nerve, that could lead to numbness in upper lip. That is the area that are supplied by infraorbital nerve. So the accidental injection into the middle superior alveolar nerve that is related with the numbness in the upper lip, teeth, gingiva, with pain on the maxillary central incisors after an infraorbital nerve block. It suggests that accidentally injecting the solution into the middle superior alveolar nerve. So the middle superior alveolar nerve innervates maxillary central incisors, and its incomplete anesthesia can lead to this cause. During a nasopalatine nerve block, the patient experiences sudden severe pain, bleeding from the injection site. So during a nasopalatine nerve block, the patient experiences sudden severe pain and bleeding from the injection site. So the sudden severe pain and bleeding from the injection site during nasopalatine nerve block, it will suggest accidental injection into the greater palatine artery. So the greater palatine artery, it is located in close proximity to the nasopalatine nerve, and its accidental puncture could result in pain and bleeding. Following a greater palatine nerve block, the patient complains of persistent metallic taste in mouth. So persistent metallic taste in mouth after greater palatine nerve block, it suggests the anesthesia of the chorda tympani nerve. It is a branch of facial nerve that provides sensation to anterior third of tongue, including the taste of the metals. So answer here is D. Following the maxillary nerve block, the patient reports numbness in maxillary teeth and palate, but they experience pain when the pressure is applied to the gingiva. So the answer is B. If the needle accidentally punctures the greater palatine nerve during the maxillary nerve block, it can result in numbness in maxillary teeth and palate, but leave the gingiva that causes pain when pressure is applied. Which nerve block is targeted in the mental nerve block? Answer is the mental nerve. A mental nerve block specifically targets the mental nerve that provides the sensory innervation to lower lip and the chin, whereas the lingual nerve, it is responsible for providing the sensory innervation to anterior 2/3 of tongue, and it is not the primary target of the mental nerve block. The inferior alveolar nerve, it provides sensory innervation to lower teeth, gums and lower lip, and it is not the primary target of the mental nerve block. The buccal nerve block provides sensory innervation to cheek and buccal mucosa. So answer is A. Which nerve is anesthetized in palatal anesthesia technique for maxillary teeth? The answer is nasopalatine nerve. So the palatal anesthesia technique primary targets the nasopalatine nerve that provides sensory innervation to anterior part of the hard palate. Which of following is a potential complication of inferior alveolar nerve block? The most important and potential complication that is associated with inferior alveolar nerve block technique is the lingual nerve that runs close to the injection site, and damage to it can result in lingual nerve numbness and altered sensation. So answer is A. The palatal tissue necrosis, it is not a common complication of IANB. TMJ dislocation is not a direct complication of inferior alveolar nerve block. Increased salivary flow, it is not typically complication of inferior alveolar nerve block. Answer is A. A patient reports numbness and altered sensation on anterior 2/3 of the tongue. So the question here say anterior 2/3 of tongue. So that will be anesthetized by lingual nerve. So numbness and altered sensation on the anterior 2/3 of tongue indicates involvement of which nerve? It's the lingual nerve. What is the potential complication of Go-Gates technique? The same lingual nerve damage. The lingual nerve runs in close proximity to the injection site, and that can result in temporary or permanent lingual nerve damage or the altered sensation. Nasal intubation, it is most commonly used in the otolaryngology study, such as the sinus surgery, septoplasty and various nasal procedure. So the answer is C. Dental surgery typically do not require nasal intubation. Oral intubation is more common in dental procedures. Which of following is contraindication for nasal intubation? So the answer is C, nasal polyp. Answer is C, epistaxis. So nasal intubation, it is contraindicated in the cases with the active or recent nose bleeding. So due to the risk of worsening bleeding, it may compromise the airway. Nasal polyp may obstruct the nasal passage and make nasal intubation more difficult, but they are not absolute contraindication. Deviated septum can make nasal intubation more challenging, but it is not the absolute contraindication. The oroantral fistula, that is abnormal connection between mouth and maxillary sinus, may make nasal intubation more challenging, but it is not the absolute contraindication. So answer is C, epistaxis. In patient with extensive maxillofacial trauma involving the leaf-foot fracture and mandibular fractures, which intubation will give the best access and stability? It's the submental intubation. So in the submental intubation, that is the technique that involves the passing of this endotracheal tube through a submental incision and then advancing it into the oropharynx. The oral intubation, it is most commonly approach. It is a common approach for airway management, but in case of extensive maxillofacial trauma, it may interfere with the surgical field. So in patient with extensive leaf-foot fractures and the mandibular fracture, the intubation that offer the best access and stability is the submental intubation. So that will allow it to bypass the fracture facial structures and avoid interference with the surgical field. The patient with a cyst at apex of upper central incisors that measures 1 cm in diameter and it is confirmed by aspiration biopsy. Which method of treatment would you consider? So you will make a mucoperiosteal flap, remove the cyst through opening in the alveolar bone, followed by endodontic treatment. A 33-year-old patient presents with throbbing pain and swelling over the mid-palatal region since 3 months. The patient has a history of trauma to upper front teeth during his childhood. On examination, you notice a mid-palatal swelling that was firm in consistency, non-tender, and the teeth was discolored and non-vital. Your diagnosis would be, well, the radicular cyst, we know that it is found commonly seen in non-vital teeth like the central incisors. It is the common presentation of radicular cyst. The radicular cyst has a well-defined radiolucent area as seen in the radiographic image. So radicular cyst, it develops as result of pulp trauma or any infection, and we can see a well-defined radiolucency in the radiographic image. So answer is radicular cyst. The following is an example of true cyst. The answer is residual cyst. A true cyst is defined as pathological cavity that is lined by epithelium. The Stephanie cyst, it is not a true cyst, it is a pseudocyst. The traumatic bone cyst, it is a true cyst. And it is characterized by cavity within the bone, and it is caused by trauma. It lacks epithelial lining, but it is still considered a true cyst. The residual cyst, it is a true cyst, and it is formed from remnants of earlier cyst that has been partially removed or incompletely removed. So answer is C. Oxygen should be stored in. So the oxygen tank, they are always stored upright and secured tightly in place. So your answer is vertically and secured. The oxygen should not be stored outside the office without proper security measures, and protection from environment factors is important. A 20-year-old male that presented with small swelling in the front of neck in midline, the swelling that moves with upward on protrusion of the tongue. So as the patient moves his tongue, protrude his tongue, the swelling moves upward. The answer is thyroglossus cyst. So it is a classic presentation of thyroglossus cyst. During submandibular incision, the closure is completed in 4 layers. So the answer is A. Platysma, trigonomegateric sling, subcutaneous tissue, and skin. The diffraction osteogenesis in child differ from that of adult that is the faster rate of diffraction. In children, the diffraction osteogenesis can proceed at faster rate due to their robust healing response. Diffraction can be initiated immediately, or rate of diffraction, it can be rapid, typically around 1.5 mm per day. So the faster rate of diffraction that will allow quicker bone formation. Moving to the question, the instrument that is used for cyst enucleation is, so what are the instruments that we use for the cyst enucleation? So the option A, chisel and mallet. So this option is a chisel and mallet. Periosteal elevator. This is periosteal elevator. This is curette. So all these three instruments we use for the cyst enucleation. So in the cyst enucleation, you typically use combination of instruments like curette, chisel, mallet, and periosteal elevator. So all these instruments will help in erasing the cyst lining from the cavity wall and hence exposing the underlying cystic cavity. So the answer here is, the correct answer is A, B, and option D. So this question was asked in one of your INICT exam recent papers. So high chances of getting them repeat in your upcoming exam. A 9-year-old child having carious maxillary lateral incisors got small swelling over the respective area. In 48 hours, the swelling enlarged and reached the lower border of the eye. So it's very sensitive to touch, hot, with painful to touch stimuli. The lymph nodes are palpable, little fever. The swelling rebounds on pressure. What would be your recommended treatment? So the presentation of a rapid, enlarging, hot, painful, and fluctuant swelling suggests that presence of an abscess. So in the context of an carious maxillary lateral incisors, it is likely that there is odontogenic infection that has led to formation of abscess. So the primary treatment for an abscess is incision and drainage. So remember this for exam point of view. So this procedure involves making an incision into the abscess to allow the pus and infectious material to drain out. The option antibiotic and hot fermentation, well, they may not be sufficient because the pus needs to be physically removed to promote healing and resolution of the infection. So antibiotic and hot fermentation, they may be the part of treatment plan, but it is not the primary treatment for an abscess. Antibiotic can help to control the infection systematically, but primary focus should be on draining the abscess. So that is why your answer here is B. Moving to the next question, bacterial spores, they are best destroyed by. So bacterial spores, they are the highly resistant to environment and they are the most resilient forms of the bacteria. So the best way to eliminate this is by autoclaving. So remember, the temperature and the pressure we use for autoclave is 121 degrees Celsius for 20 minutes. That's the standard temperature. So that will kill all the viable microorganisms, including the bacterial spores, making it a reliable method for sterilization. So answer is C. Trunner's technique is, well, Trunner technique, it is done to increase the depth of floor of mouth in the mylohyoid region. So the Trunner technique, it is a surgical procedure that is used to increase the depth of floor of the mouth. So what you will do is you will make an incision on the lingual side of the alveolar ridge in the posterior region. So, and performing a supraperiosteal dissection. So, during the supraperiosteal dissection, the incision is made along the lingual side of the alveolar ridge. Typically in the posterior region, the periosteum is then gently lifted or separated from the underlying bone to expose the mylohyoid muscle. So once the mylohyoid muscle is identified, it can be separated from its attachment and repositioned or sutured to achieve the desired vestibular depth. So that will increase, it is done to increase the depth of floor of mouth. That is the Troner technique. So Troner technique is increasing the depth of floor. So option B is the answer of choice. So apart from that, we have various other technique. They are the number one, I have discussed, it is the Turner's technique. Other is Caldwell technique. So it is similar to the Turner technique, but it involves a more extensive dissection of the mylohyoid muscle. So in this technique, the muscle is completely separated from its attachment to the bone. The muscle is then sutured at lower position to increase the depth of floor of mouth. The other technique is Obwegerser technique. So remember, these are the three techniques: Turner technique, Caldwell, and Obweger's. So this technique differs from the Turner and Caldwell that it involves a submucosal vestibuloplasty. So instead of dissecting and suturing the mylohyoid muscle, so this technique focus on the submucosal layer. So the incision, it is made along the mucogingival junction and submucosal dissection is performed. So the submucosal tissue is then advanced and sutured to create the desired vestibular depth. So all these three techniques aim is to increase the depth of floor of mouth. Moving to the next question. Air entrapped in case of subcutaneous emphysema is generally absorbed in. Well, the air trapped in the case of subcutaneous emphysema, it is usually absorbed over time as the body naturally reabsorbs the trapped air. So the answer is 1 to 2 weeks. So that is the correct time. Subcutaneous emphysema, it is typically absorbed gradually by the body tissue over a course of 1 to 2 weeks. So remember, this subcutaneous emphysema, it is a self-limiting condition. What that means? That means that it will resolve on its own as body will absorb the trapped air, and underlying cause of emphysema should be identified and treated to prevent its reoccurrence. Next question, the Dean's technique is. So this question is important for your entrance exam. It is intraseptal alveoplasty. So Dean technique, it is also known as intraseptal alveoplasty. So that is done to reshape and smooth the alveolar ridge. So this figure has been taken from the Balaji oral surgery. So this technique is primarily done to create a more favorable and even ridge to ensure the proper fit and stability of the dental prosthesis. So after the tooth that has been multiple tooth that they have been extracted, small incisions they are made in the gum tissue near the alveolar ridge. So dentists will reshape the bone within the alveolar ridge. Uh, in Dean's technique, the focus is on removing bone from the septum. So that is the bony partition between the adjacent tooth socket that will create a uniform ridge. So the bone, it is eliminated, contoured, and there should be is checked for any irregularity or sharp edges or any undercut. So that can hinder the placement of the denture. So once the desired shaping is achieved, the incision, they are closed with the sutures. So Dean's technique, it is useful in cases when there are bony irregularities or exostosis along the alveolar ridge. So that helps to create a more suitable foundation for the dental prosthesis. So Dean's technique is simply intraseptal alveoplasty. Remember that for your exam point of view. Next question. The ideal method for intubation in patient with bilateral TMJ ankylosis and retruded mandible, it is video laryngoscopy. Well, in patient with a bilateral TMJ ankylosis and retruded mandible, uh, intubation can be extremely challenging. As we know that TMJ ankylosis, it refers to the fusion or limited movement of the TMJ joint that can limit the ability to open the mouth. So in that case, a video laryngoscopy, it is considered an ideal method for intubation. Why we will be considering this video laryngoscopy? So video laryngoscopy has an improved visualization. Why? Because there is a inbuilt camera and a video screen. So that will provide a clear and magnified view of the glottis, that is the opening to the trachea and surrounding structure. So even when the mouth opening is limited, that will improve the oral surgeon visualization. That would be crucial or important or successful for intubation. So other option is limited mouth opening, since there is a limited mouth opening and a retruded mandible. So that will increase the risk of trauma during intubation attempts. There could be damage to teeth and soft tissues. So video laryngoscopy offer a more approach, as the things would be clear on the screen to visualize. So that will reduce the risk for complication. So it is a safer approach for intubation. Moving to the next question, the distant metastasis from the oral cavity frequently involves the distant metastasis from the oral cavity most frequently involves the lung. The lung metastases, they are more common in patients with oral cavity cancers compared to other distant organs. After the lungs, the liver, bone are the most common site for the distant metastases from the oral cavity cancers. So your answer of choice would be mark lungs in your exam. The most common malignancy of submandibular gland is, well, the most common malignancy is the adenoid cystic carcinoma. Well, remember adenoid cystic carcinoma, it is the most common malignancy of the submandibular gland. Next question, the most important feature of pleomorphic adenoma from the surgical standpoint is, well, the most important feature is the presence of pseudocapsule. So the presence of pseudocapsule is important as the attempts at the enucleation, that is removal of the tumor from its pseudocapsule, that should be done very carefully. That can lead to incomplete removal of the tumor, leaving behind the viable tumor cell nest. So there can be chances of reoccurrence. Let us move to the next question. The majority of the minor salivary glands in oral cavity, they are located, the majority of the glands, they are located at the junction of hard and the soft palate. So mark answer D. Next question. Lissigang's rings, they are found in, they are found in CEOT. That is, Lissigang's rings, they are distinctive histological features in CEOT. So these rings will represent the amyloid like material, and they appear as concentric rings in the circles. The rings are in the circle, that is why they are concentric rings when you view it under microscope. So that feature helps to identify and diagnose the CEOT. Very important for your exam point of view. Next is Zanetta procedure is. So Zanetta procedure, it is also known as microvascular decompression. So that is a treatment that is done for the treatment of the trigeminal neuralgia. So the problem in the trigeminal neuralgia, it lies because a blood vessel that is the superior this superior cerebellar artery is pressing on the nerves, this nerve. So this artery will be pressing on this trigeminal nerve. So that pressure on the nerve, that will cause intense pain. So in the surgery, the surgeon main job is to carefully move this blood vessel away from the nerve. That will relieve the pressure. So by doing this, they can stop the nerve from sending pain signals to your brain that can alleviate or reduce the pain that patient with the trigeminal neuralgia experiences. So Zanetta procedure is microvascular decompression. Mark your answer. Which of following flaps can be used for reconstruction of larger lower lip defect? The answer here is Bernard flap. Now let us discuss these flaps. The number one, Bazod flap. Remember, for your entrance exam, just remember this flap. It is used in which procedure? Tracheostomy procedure, and it is not used for reconstruction of the lower lip defect. Next is the Bernard flap. Remember, it is, yes, this Bernard flap, it is used in reconstruction of large lower lip defects. So it is used in reconstruction of large lower lip defect. Bingo. So it is known for its ability to reconstruct almost the entire lower lip. So entire lower lip in a single stage procedure. The third option is a Millard flap. Remember the Millard, it is used for repairing the congenital lip and the palate defect. The Rarman flap, remember, it is used for closure of oral enteral fistula. That is abnormal communication between the oral cavity and the maxillary sinus. Uh, Millard flap, it is used for the cleft lip and palate surgeries. So answer is Bernard flap. Hope it is clear. Identify the type of wiring. Well, it's the very simple question. It's the Gilmer direct interdental wiring. So the most simplest and rapid method of immobilization of jaw is it's the Gilmer method. So here the middle portion of the wire, it is twisted around the tooth. So the free tails of wires, they are then twisted together to form a plated tail. So that will allow stability and allow for intermaxillary fixation. So after reducing the fracture, the separated tails of wires, they are twisted together in both upper and lower jaw, and this fixation would help to maintain the proper alignment of jaw during the healing procedure. What is the direction of fracture line in horizontal unfavorable fracture? The answer is A, the lower border in an upward and forward direction to meet the upper border. So this one is an example of horizontally unfavorable fracture. So in this, the fracture line runs from lower border of mandible in upward and forward direction, meeting the upper border of the mandible. So that is your answer of choice. More about favorable unfavorable fracture, we have covered it in fracture chapter. Please go through that to get more clear view. Partial operation, it is marsupialization alone. So well, uh, marsupialization, it is a surgical procedure in which the cystic cavity, suppose this one is the cyst, the cavity of the cyst is opened and its wall, they are sutured to edges of the oral mucosa. So that will create a drainage pathway uh, into the oral cavity. So the surgeon will make an incision or opening into the cyst cavity. So that will allow access to the contents inside. Surgeon then carefully sutures or stitches uh, the wall of cyst to the surrounding oral mucosa. By attaching the wall of cyst to mucosa, a pathway is created for fluids for drainage. So Pash operation is marsupialization alone. Remember that for your exam point of view. Supraomohyoid dissection, it is done when the lymph nodes are removed to level. The answer is answer D, that is level 3. So the supraomohyoid neck dissection, it is a surgical procedure that is done to remove the lymph nodes from the neck. So the lymph nodes, they are removed up to level of level 3. So this is supraomohyoid dissection. So in level 1A refers to removal of lymph in the submental region, and 1B it refers to the removal of the lymph node in the submandibular removal of the submandibular nodes. Level 2 includes the lymph nodes that are found in the upper neck along the upper third of the internal jugular vein. Level 3 means the lymph nodes, they are situated along the middle third of the internal jugular vein. They extend from the top of hyoid bone to the bottom of the cricoid cartilage. Palatopharyngeal incompetency, it can be corrected by using the pharyngeal flap surgery. It is usually done to correct the valvopharyngeal insufficiency by creating a flap of tissue from the posterior pharynx and attaching it to the soft palate. So that will these flaps will serve to improve closure of valvopharyngeal port during speech, and that will improve the speech resonance. So palatopharyngeal incompetency itself means that there will be inability of the soft palate and pharynx to function properly during the speech and swallowing. So this correcting palatopharyngeal incompetency is important for improving the speech and swallowing function. So pharyngeal flap surgery that may be given. Apart from that, palatal lift prosthesis may be given. So this device will lift and support the soft palate, helping it to make better contact with the back of throat. So palatal lift surgery, it is so that will be the answer of choice. Moving to the next question. Bifocal distraction is so in bifocal distraction, two bone segments across across two osteotomies. So that involves the separating two bone segments across the two osteotomies. That is, you have to make a cut in the bone, and these segments uh, shift toward each other to fill a void space. So focal distraction, that involves the separation of two bone cut across a single osteotome, across a single osteotomy. That means cut in the bone, a single cut in the bone. So it is used when unifocal means when one bone segment needs to be moved, whereas the bifocal distraction is used when the defect in bone leads to separation of two bony segments. By such a distance that interpositional bone is required to align the two segments. So this technique, it is suitable when gaps or void exist between the bone segment that need to be aligned. So the example of bifocal distraction, it is commonly used in correction of mid-phase and maxillary deficiency. The trifocal distraction is similar to bifocal, but it involves the use of the two bony discs that are distracted from opposite ends toward each other to dock in the middle. So this technique is used when there is larger defect that require more extensive correction and when three bone segments need to be aligned. So it's used in the case of complex craniofacial anomalies that involves both horizontal and vertical correction. While removing the ankylotic mass from TMJ, what should the surgeon be prepared of? The answer is A. While removing ankylotic mass from TMJ, the surgeon should be prepared for possibility of sudden hemorrhage from the pterygoid plexus, venous plexus, or the internal maxillary artery. So these structures, they are lie very closely in close proximity to the TMJ region. Operating theaters, uh, they are sterilized by using formaldehyde gas. We know formaldehyde, it is effective disinfectant and sterilizing agent that is used to fumigate and sterilize the environment, including the surfaces and equipments in the operating rooms. So answer is C. Which of following cyst is rarely seen in maxilla? It's the solitary bone cyst. They are morely common in mandible as compared to maxilla. In visor osteotomy, which cortices is placed superiorly? So in visor osteotomy, the lingual cortex of the mandible, it is placed more superiorly. So this surgical procedure involves the central splitting of the mandible in buccolingual direction. and the lingual section of the mandible, it is placed superiorly, and the wires in place. Which of following is done for increasing the depth of floor of mouth? It's the Troner technique. We have discussed this technique already, so answer is C. Mark that. Other options, the Clark technique, it is used for vestibule. It is a technique that is used for vestibuloplasty. Its main focus is increasing the depth of labial vestibule. Kazanjian technique, it is a technique that is used for vestibuloplasty, and it involves creating a submucosal tunnel to increase the vestibular depth. And it can be used for both labial and lingular vestibuloplasty. Which of following is not the choice of treatment of the ameloblastoma? Ameloblastoma, it is typically treated with surgical excision. Surgical removal of the ameloblastoma lesion, it is the primary and most important approach to manage this tumor. Cauterization and chemotherapy, they are not typically used as they are not the primary treatment for ameloblastoma. Radiotherapy is generally not the first line treatment for ameloblastoma because we know ameloblastoma tumors, they are radio resistant. So answer is, mark answer C as your choice. Multiple odontogenic keratocyst, mandibular prognathism, cutaneous ophthalmic anomalies, they are feature of basal cell nevus. Basal cell nevus, it is also known as Gorlin-Gotch syndrome, that is characterized by multiple odontogenic keratocyst, mandibular prognathism, and various cutaneous and ophthalmic anomalies. So remember, this occurs due to the mutation in PTCH1 gene. Remember that other features include the palmar-plantar pits, skeleton anomalies, and increased risk of basal cell carcinoma. Which of following incision is used to expose maxilla while performing maxillectomy? Well, it's the Weber-Ferguson incision. Weber-Ferguson incision, it is commonly used incision to assess the maxilla during maxillectomy. So that involves making an incision that splits the midline of the upper lip. So for the better cosmetic results, the incision is given along the filtral ridges and along the vermilion border. So this incision provide access to maxilla and allow for surgical procedure in this region. If the voluntary tongue control is lost, the best way for management of airway in that case would be, so when the voluntary tongue control is lost and there is risk for airway compromise, the best management is to secure a definite airway. So ensuring a stable and secure airway, it is our priority in situation where tongue control is lost and there is risk for airway compromise. In Abbe cylinder flap, they are used for reconstruction of lip. So they are. It is the Abbe cylinder flap. It is a surgical technique that is used in reconstruction of lip. So that is specifically designed to address the full thickness loss of the lip. So the technique involves the use of local flaps to repair the lip defect, and it is the most common used for lip reconstruction when there is a significant defect that require tissue transfer from one area to other area of the lip. In performing mandibular nerve block for child patient, the most probable cause of failure of anesthesia is, well, the answer is B. Given very clearly in your Shoba tendon, when performing a mandibular nerve block for child anesthesia, the angulation of the needle, it may be a need to adjust due to difference in the anatomy compared to the adults. As we know that the mandibular foramen in the children, it is located at the lower level than the occlusion plane of the primary teeth. So that means the injection must be made slightly lower. Failure to adjust the needle angulation to accommodate this difference in anatomy, it can lead to lack of anesthesia in desired area that can result in failed block. So the correct needle placement, it is essential for successful administration of mandibular nerve block in children. The advantage of nasotracheal intubation is, answer is C. The nasotracheal intubation where the tube it is passed through nose into the trachea. So this tube is passed from the nose into the trachea. So this tube avoids it avoids the need to have a tube in the oral cavity. So that can help to maintain a better oral hygiene during the period of intubation. So that's your answer. Which of following is used to show case of skull sphenoid sinus position, orientation of condyle and fracture of zygomatic arch? The submentovertex view, it is also known as base or skull axial view, that is used to know the various aspects of skull sphenoid sinus, orientation of condyles and fracture of zygomatic arch. During the administration of posterior superior alveolar nerve block, the landmarks that guide the operator are anterior border of coronoid process and the answer is A, anterior border of ramus. Moving to the next question, which of following is used to assess the Glasgow coma scale of the trauma patient? Yes, eye response, well it is used, verbal response, motor response, the answer is all of the above. So in Glasgow coma scale of the trauma patient, we use various responses like the eye opening response, verbal response, and the motor response. So for eye opening response, the scores are 1, 2, 3 and 4. 1 means no response, second means eye opening to the pain, 3 means eye opening response to speech. So the verbal response similarly are categorized into 1, 2, 3, 4 and 5. So the answer is D, all of the above. So these three components, they are assessed and a patient, it is assigned a score based on their responses in each category. So these scores, they are then added together to determine the patient overall Glasgow coma scale score. All of the muscle may cause displacement of fracture segment in the mandible except is Caninus. So the answer is caninus. A easy question. The muscle that causes the displacement of fracture segment in the mandible is the medial pterygoid, lateral pterygoid, and the masseter. And caninus, it is not involved. Moving to the next question, most common cause of pulmonary embolism. The most common cause of pulmonary embolism is thrombophlebitis. So the pulmonary embolism, it results from the thrombi or the clots that forms in the deep vein of the legs. That can break free and travel to lungs and hence causing a blockage. So the most common cause of pulmonary embolism is the thrombophlebitis. A 75-year-old woman whose weight is approximately 100 pounds require multiple extraction under LA. For pre-medication, the following dose of diazepam it is enough to lay the apprehension. The answer is 10 milligram. So in case of 75-year-old woman whose weight is approximately 100 pounds, a starting dose of 10 milligram of diazepam may be given. So that is a relative low dose and it is safe for the patient. Moving to the next question, the post-extraction bleeding in a leukemic patient is due to the we know it is due to the platelet disorder. We know leukemia, it is a type of blood cancer that affects the bone marrow and blood cells, including the platelets. So platelets, they play an important role in blood clotting process. In leukemia, what you will see, there will be production and function of platelet that would be impaired. So that will cause that will lead to the decreased ability of the blood to clot properly. So to address post-extraction bleeding in leukemic patient, it is essential to manage their platelet disorder. A patient with the carcinoma of tongue has also enlarged lymph node of lower neck. The treatment is, well, the best answer here is supraomohyoid neck dissection. So in case of carcinoma of tongue with lymph node, the choice of treatment, it can vary on the factors like stage of cancer, size, location of lymph nodes, whether they are unilateral or bilateral. So both suprahyoid neck dissection and radical neck dissection can be considered with the lymph node involvement, but the choice between these options depends upon the extent of disease and the goal of treatment. The supraomohyoid neck dissection, it is more limited neck dissection that involves the removal of lymph node in upper part of the neck. So when there is less extensive lymph node involvement, supraomohyoid neck dissection is considered. Whereas the radical neck dissection, it involves the removal of more extensive structures like the lymph nodes, muscles and other tissue. So the answer is B. Which of following procedure can be used to treat oroantral fistula resulting from posterior surgery? The answer is all of them. So the choice of which technique to use, it will depend upon the characteristic of fistula and patient anatomy. The surgeons will select the most appropriate approach based on factors like the size, location of fistula, condition of surrounding tissue and the overall health of the patient. So this image shown is a palatal island method of flap design that we use for the treatment of oral antral fistula. The answer is all of the above are correct. In an edentulous patient, it has a carcinoma of oral cavity that infiltrate into the alveolar margin. Which of following would not be indicated in managing the case? So in management of patient with the carcinoma of oral cancer that infiltrate into the alveolar margin, a marginal mandibulectomy that would not be a marginal mandibulectomy involving the removal of the outer table only would not be indicated. So this procedure would not result in total removal of the lesion. So the segmental mandibulectomy, option C, marginal mandibulectomy with removal of upper half of mandible and radiotherapy, they are all potential treatment that can be considered depending upon the extent of the carcinoma. The most important purpose during extraction. Answer is C, least trauma to the tooth. Leads trauma to the bone and mucosa while extracting the tooth in pieces. So the ideal goal during that tooth extraction is to achieve the removal of tooth or tooth root with minimal trauma to the surrounding tissues that involves both the bone and the mucosa. So the primary objective is to minimize the trauma to both bone and mucosa for uneventful healing process. Dry socket during extraction of tooth, it is caused due to the disintegration of the blood clot. Dry socket, it's also known as, remember the other name of dry socket is alveolar osteitis. So that occurs during the tooth extraction when the blood clot that normally forms in the socket, it gets disintegrated and that leads to exposed bone in the socket. So this bone would be extremely painful, and that would result in delaying of the normal healing process. So in the dry socket, the affected area will become inflamed and patient will feel severe pain. The options like Staphylococcus aureus infection, while these bacterial infections, they can complicate the healing process after wound healing. Dry socket is primarily associated with loss or disintegration of the blood clot. It is not typically caused by prolonged antibiotic cover or an unsutured socket. So answer is definitely B. Zygomatic arch fracture can be best seen in, so the zygomatic arch fracture they are best seen in the submental vertex view. So the submental vertex view, it is a radiographic view that is commonly used to visualize the zygomatic arch fracture. So it provides a clear specific view of the zygomatic arch, and it is considered the view of choice for diagnosing these fractures. Jumping genioplasty, it is a term that connects. The answer is B, double step genioplasty. So jumping genioplasty, it is also known as a two-step genioplasty. So in jumping genioplasty, what we do is we divide or cut the chin into two segments and then move them separately to achieve more advancement or lengthening of chin. So that can involve both the horizontal and the vertical movement of the segments depending upon the patient need. So to maintain the new position of the chin segment, these segments, they are secure in place using small plates, screws or other fixating devices. The odontogenic keratocyst, it is noted for its answer is B, daughter cell cyst and high rate of reoccurrence. So the OKC, it is known for presence of daughter cyst along with the primary cyst, and it has a high rate of reoccurrence. So the thin, remember the thin and fragile lining of cyst that can make it more prone to rupture and more prone to reoccurrence. Sequestrum, well, sequestrum, it is a piece of dead bone. So it is radiopaque that has become separated from the surrounding living bone tissue. So these sequestra, they are radiopaque, meaning that they appear radiodense and white on X-ray images due to their calcified nature. So they are seen in conditions like osteomyelitis. So where a portion of bone it dies and become detached from rest of bone. What is ASA status 3? So remember this classification. The ASA3 is severe disease process which limits activity and it is not capacitating. So answer is C. So these patients will have systemic illness that significantly affect their daily life and health but is not immediately life threatening. So answer is C. Remember this classification. The most common bacteria that causes subacute bacterial endocarditis, it's the alpha hemolytic streptococci. So subacute bacterial endocarditis, it is commonly caused by viridans, group streptococci, which are the alpha hemolytic streptococci. Open reduction and fixation of fracture of mandibular condyle, it is indicated when there is shortening of ramal height more than 5 mm. So open reduction and fixation, they are indicated when there is shortening of ramal height typically exceeding 5 mm. So that means that condylar fracture they has been displaced significantly and they require surgical intervention to restore proper anatomical alignment and function. Nasal intubation, it is contraindicated in CSF rhinorrhea. The nasal intubation, it is contraindicated in CSF rhinorrhea. So CSF rhinorrhea is the leakage of the cerebrospinal fluid from the nose. So that can occur due to the reason of fracture of the base of skull. So in such case, what oral surgeon will do, he will introduce a nasal, in such case introducing a nasal tube that will worsen the condition by further disrupting the integrity of the skull base, and there could be increased risk of infection and complication. In a 48-year-old patient with a treatment of dentigerous cyst with impacted molars lying near the lower border of mandible, treatment would be marsupialization with IMF. So marsupialization, it is the process in which opening is created in the cystic lining, allowing for the continuous drainage and decompression of the cyst. That part we have already discussed in the previous MCQ. After that, IMF is done. So that involves the temporary wiring with upper and lower jaws to immobilize them. So that is done to prevent the masticatory forces from further causing expansion or damage to the cyst affected area. So the proximity of the third molar near the lower border with cyst in angle fracture that can lead to pathological fracture of the mandible. So after some bone has formed, then molar can be removed and dressing with IMF should be continued. The greater palatine foramen, it is present. It is present between the second and third maxillary molar. Which of following is not a absorbable suture? The answer is Dacron. So it is a synthetic non-absorbable suture that is made from the polyester fibers. The catgut, chromic catgut, they are the absorbable sutures. Polyglycolic acid, it is another example of absorbable sutures. So Dacron, it is non-absorbable suture material. According to the TNM classification, if the metastasis lymph node is more than 3 cm but less than 6 cm in greatest dimension, it would include all of the following except. So you can see their classification here. The answer here is N1. So N1 is metastasis in single epsilateral lymph node 3 cm or less than in greatest dimension. So if the metastasis is more than 3 cm is asked in question, so N2B, N2C, N2A follow all these criteria. So answer is D, N1. Which of following feature it is not associated with acute osteomyelitis of mandible? In case of acute osteomyelitis of mandible, radiographic evidence of bone destruction, it is not associated with the condition. So these radiographic changes that you would see more in the chronic osteomyelitis than in the acute one. So answer would be D. A patient 14 years of age presented with swelling on right mandible. The adjacent teeth were vital. Radiologically, there were extensive radiolucent lesions with scalloped margin that extends between the roots and lamina dura was intact. On aspiration, you see a yellow colored fluid. Diagnosis is hemorrhagic bone cyst. That is also known as simple bone cyst. Treatment of keratocyst is the treatment of keratocyst. These cysts generally penetrate the cortex and therefore excision of the cyst containing the bony block it is indicated. So answer is C. In a 30-year-old patient, the treatment including dentigerous cyst with impacted molar lying near the lower border of mandible would be, answer is C. Already discussed this question. In cyst of maxilla involving the maxillary sinus, marsupialization pack should be changed from So when managing the cyst of maxilla that involves the maxillary sinus and performing the marsupialization, the pack it should be always changed through the nasal enterostomy. So that is done to encourage the growth of the nasal epithelium that is similar to the antral epithelium. The nasal epithelium, we know it is ciliated pseudostratified columnar epithelium. So that is more similar to the lining of maxillary sinus. So changing the pack through nasal enterostomy allows for the development of lining that is functionally closer to the normal sinus epithelium. That will facilitate proper drainage and prevents the complication. So that is why answer is A. Excisional biopsy, it is characterized by, so answer is D, including normal tissue and all of the lesion. So excisional biopsy, that is characterized by removal of the entire lesion, and it includes the margin of normal tissue surrounding the lesion that will ensure a complete removal. So that is done for the smaller lesions that appears to be benign. So in excisional biopsy, we remove the entire lesion along with the margin of the normal tissue. So along with the normal tissue, blood spill in hospital, they are cleaned by using sodium hypo. So it is affected against various viruses like hepatitis B virus, and it is a chlorine releasing disinfectant. So it is affected against broad spectrum of pathogens including viruses. The infection from the lateral pharyngeal space can spread from the mastigator space. So the mastigator space will contain the muscle of mastication, like the masseter and temporalis muscle. So from the masseter space, the infection can extend into the adjacent lateral pharyngeal space. Severe trismus, it is a characteristic feature of masticatory space infection. So trismus is the inability of the mouth to open due to the muscle spasm. So the masticatory space is an anatomical compartment in the head and neck that contains the muscle of mastication including the masseter, temporalis and pterygoid muscle. So infection in this space will cause swelling and pain and limited mouth opening, that is trismus, due to the inflammation and the muscle involvement. Self-aspirating syringes, they provide aspiration by. So this question was asked in one of the AIMS SRship exam. The answer is D. Pulling the thumb ring. Some self-aspirating syringes, they are designed with a thumb ring that can be pulled back to create a negative pressure within the syringe barrel. So when you pull the thumb ring, it creates a suction, allowing you to aspirate small amount of fluid from a vial or ampule. B. Negative pressure created due to the elasticity of rubber diaphragm. So when the plunger it is pulled back, it stretches the rubber diaphragm, creating a vacuum that will allow you to aspirate the substance. Third is pressure release on the thumb disc. The pressure release on thumb disc, that refers to the action of pushing or depressing the thumb disc that can release the negative pressure created within the syringe. So all of them are true. Infection from the submandibular space and submental space, they travel to the anterior mediastinum. The anterior mediastinum, it's a region within the chest that is located in the front of heart and between the two lungs. So infection that originates from the submandibular space and submental space, it can travel downward and anteriorly crossing into the anterior mediastinum. So the anterior mediastinum, it contains structures like thymus gland, lymph nodes and connective tissue. Next question. How long one should wait before obtaining a biopsy of an ulcer in oral cavity? It's generally recommended to wait for about 14 days before obtaining a biopsy. So the oral ulcer, as we know, the minor oral ulcer, they will heal on their own within a couple of weeks. So waiting of around 14 days allows for the natural healing process to take place. If the ulcer does not heal with this time frame, then you may consider chronic or non-healing ulcers. So for that diagnosis, you need a biopsy. During suturing of skin, the edges are. So during suturing of skin, the goal is to avert the tissue edges. Eversions means that the edges of wound, they are turned outward or flipped upward when the sutures are placed. So that technique results in good tissue approximation that is essential for the wound healing, as these everted edges will promote a better wound closure and reduce the risk of scar formation. The laryngeal mask airway used for the securing the airway of patient in all of condition except. The answer is D. LMA can be used as an alternative airway management in case where endotracheal tube is difficult or cannot be achieved. It is used during CPR to establish a patient airway and assist with the ventilation when intubation is not feasible. It can be used for securing the airway in pediatric patients undergoing the eye surgery. It may not be suitable for the patients with large oral tumors. In such case, airway management techniques like the tracheostomy or fibro-optic intubation may be considered. Blepharoplasty is the subciliary incision. So it is a procedure that is used for eyelid regeneration to address the issues like excess skin, fat or muscles in the eyelid. So it can include various type of incisions like the subciliary incision that is given below the eyelashes on the lower eyelid, or transconjunctival incision that is given inside the lower eyelid. So answer is A. The Pinbock tumor, it arises from answer is stratum intermedium. The tumor cells, it resembles to the cell of stratum intermedium of the enamel organ. Some believe that it resembles the dental lamina. rise from the dental lamina, but the best answer is stratum intermedium. Drainage of abscess is done by which number of blade? It's number 11. Number 10 is made for making skin incisions. Number 11 is made for stab incisions. Number 12 is used for mucogingival surgeries. And number 15 is used for intraoral surgeries. So drainage of abscess, it is done with a number 11 blade. Tronar incision, we have discussed this question before too, that is done to increase the depth of floor of mouth in the malahyoid region. How can the effect of infraorbital block be achieved in young children? So it can be achieved by infiltration anesthesia in the canine maxillary first primary molar region. This method is commonly used to provide anesthesia in the maxillary anterior region in the young children. So answer here is C.